Welcome to today's lecture on chest injuries. In this presentation, we will cover the mechanics of ventilation, different types of chest injuries, their signs and symptoms, and appropriate pre-hospital management strategies. To understand chest injuries, we must first understand how ventilation works. Inhalation occurs when the intercostal muscles and diaphragm contract, creating negative pressure that pulls air into the lungs. Exhalation is a passive process where these muscles relax, allowing air to exit. Normally, the body should not have to work to breathe at rest. This figure illustrates the mechanics of inhalation and exhalation. As we inhale, the diaphragm contracts and moves downward, expanding the thoracic cavity. During exhalation, the diaphragm relaxes, pushing air out of the lungs. Patients with spinal injuries at or below C5 can still breathe using the diaphragm, as the phrenic nerves that control it originate from C3 to C5. However, injuries above C3 may result in respiratory failure, as the ability to breathe is compromised. Tidal volume refers to the amount of air moved in and out of the lungs in a single breath. Minute ventilation is calculated by multiplying tidal volume by the respiratory rate. Any changes in these values can significantly impact oxygenation and ventilation. Chest injuries are classified as either open or closed. In a closed chest injury, the skin remains intact, and the injury is typically caused by blunt trauma, such as impact with a steering wheel in a motor vehicle collision. Closed chest injuries can cause serious complications, such as cardiac or pulmonary contusions. If the heart is damaged, it may not effectively pump blood, and lung bruising can reduce the surface area available for gas exchange. Rib fractures can worsen the injury by damaging internal structures. Open chest injuries occur when an object penetrates the chest wall. This may be caused by a knife, bullet, piece of metal, or a broken rib. It is crucial not to remove impaled objects, as they may be controlling bleeding or preventing further injury. Blunt trauma to the chest can result in fractures of the ribs, sternum, or chest wall, bruising of internal organs, damage to the aorta, or even the detachment of vital organs from their attachments in the chest cavity. Common signs and symptoms of chest injuries include localized pain, increased pain with breathing, bruising, crepitus, a crackling sensation under the skin, penetrating wounds, and difficulty breathing, known as dyspnea. Additional symptoms may include coughing up blood, hemoptysis, uneven chest expansion, a rapid weak pulse, low blood pressure, cyanosis around the lips and fingernails, diminished breath sounds, and low oxygen saturation. Patients with chest injuries often breathe rapidly and shallowly to minimize pain. It is essential to auscultate at multiple locations to assess for adequate breath sounds and ensure proper air movement. Pneumothorax, commonly called a collapsed lung, occurs when air accumulates in the pleural space, preventing lung expansion. Blood passing through the collapsed area is not oxygenated, leading to respiratory distress. This diagram illustrates how a pneumothorax develops. Air leaks into the pleural space, causing the lung to collapse. This may result from an injury to the chest wall or damage to the lung itself. An open chest wound, also called an open pneumothorax or sucking chest wound, allows air to pass freely in and out of the pleural space. These wounds must be sealed immediately with an occlusive dressing, and the patient should be monitored for signs of tension pneumothorax. This figure shows how air enters and exits a sucking chest wound, creating a characteristic sound with each breath. Rapid intervention is needed to prevent respiratory compromise. A simple pneumothorax does not initially cause major changes in cardiac function, but can worsen over time. This condition often results from blunt trauma, such as a fractured rib puncturing the lung. Tension pneumothorax occurs when air continuously accumulates in the pleural space, causing increased pressure. This can collapse the opposite lung and shift the mediastinum, compressing the heart and great vessels, leading to life-threatening consequences. This diagram shows how a tension pneumothorax can develop if a sealed chest wound prevents air from escaping. Monitoring for this condition is crucial, as it can cause cardiovascular collapse. Hemothorax occurs when blood collects in the pleural space, typically due to bleeding from the rib cage, lung, or major vessels. This can lead to respiratory distress and hypoxia. This image illustrates hemothorax and hemopneumothorax, a condition where both air and blood accumulate in the pleural space, further compromising breathing. Signs and symptoms of hemothorax include shock without external bleeding, decreased breath sounds on the affected side, and respiratory distress. Rapid transport is crucial for patient survival. Cardiac tamponade occurs when blood or fluid accumulates in the pericardial sac, restricting the heart's ability to pump effectively. This is a life-threatening condition requiring immediate intervention. This diagram demonstrates how fluid accumulation in the pericardial sac compresses the heart, impairing circulation and leading to shock. Classic signs of cardiac tamponade include Beck's triad: jugular vein distension, muffled heart sounds, and hypotension. Rapid transport and supportive care are essential. Rib fractures are common, especially in older adults. A fracture of one of the upper four ribs suggests a significant mechanism of injury. These fractures can cause complications such as pneumothorax, hemothorax, or hemopneumothorax. Signs and symptoms of rib fractures include localized tenderness, pain with breathing, and rapid, shallow respirations. Patients often hold the affected area to minimize movement. Pre-hospital treatment includes supplemental oxygen and pain management. Flail chest occurs when multiple adjacent ribs are fractured in multiple places, creating a segment that moves paradoxically with breathing. This is a serious injury that can impair ventilation and oxygenation. Pre-hospital treatment includes maintaining the airway, providing respiratory support if necessary, and administering supplemental oxygen. Continuous assessment for complications is crucial. Treatment may require positive pressure ventilation using a bag valve mask. The previous practice of restricting chest wall movement is no longer recommended. Flail chest often indicates severe internal injury or spinal trauma. Pulmonary contusion should always be suspected in a patient with flail chest. Blood accumulates in the alveoli, impairing gas exchange and leading to hypoxia. Treatment includes oxygen and positive pressure ventilation if needed. Sternal fractures increase the likelihood of underlying organ injury. Clavicle fractures may damage the neurovascular bundle. Upper rib fractures, particularly medial clavicle fractures, should raise suspicion for pneumothorax. Traumatic asphyxia is characterized by distended neck veins, cyanosis in the face and neck, and hemorrhages in the sclera of the eyes. This results from severe compression of the chest, preventing blood return to the heart. This injury often indicates significant trauma to the heart and lungs. Pre-hospital care includes ventilatory support, oxygen administration, and rapid transport while monitoring vital signs. Blunt myocardial injury occurs when the heart muscle is bruised, potentially leading to arrhythmias and reduced cardiac output. Signs include chest pain and an irregular pulse. This injury should be suspected in all cases of severe blunt chest trauma. Treatment includes monitoring for arrhythmias, administering oxygen, and immediate transport to a medical facility. Commotio cordis is a rare but fatal condition that occurs when a sudden blow to the chest disrupts the heart's electrical activity, leading to ventricular fibrillation and cardiac arrest. Laceration of the great vessels results in massive hemorrhage and rapid deterioration. Pre-hospital care focuses on CPR, ventilatory support, oxygenation, and immediate transport to the nearest trauma center.